to Justice to Healing. I'm Kristen DeVall, a co-director of the National Drug Court Resource Center, and I'm joined by the other co-director, Dr. Christina Lanier.
Hello, everyone.
Today we are joined by Dr. Sally MacKain, a clinical psychologist and professor of psychology at the University of North Carolina, Wilmington. Welcome, Sally.
Thanks so much for having me.
Can you talk a little bit about your training and how you got interested in self-care?
Yes, as a clinical psychologist, self-care has become a really important factor. I am involved in the training of doctoral level clinical psychologists, and it was interesting following this accreditation process we've been going through for our program that self-care of clinicians is really an ethical obligation. And so when we're training future therapists, that we really have to teach them the importance of self-care, what it is, and that it is actually, we cover the material in an ethics course because we talk a lot about professional competence in all of the service fields, right? If you are trained properly, you then have professional competence to do the job that you've been trained to do.
Mm-hmm.
But most people don't think about personal competence, which relates to that ethical obligation to really take care of ourselves, check in with ourselves in terms of how we're feeling physically, emotionally, cognitively, because if we don't take care of ourselves, we start to be in a position where we could actually harm people.
Mm-hmm.
So burnout is certainly a concern in terms of self-preservation, but just in terms of the services you're giving to the person, they won't be effective if you're not taking care of yourself. My journey through the clinical psychology field started with working with people with serious mental illness and also with people in recovery from substance use, because we find that about 60% of people who have a diagnosed mental illness also struggle in some way with a substance use problem. And so in the 80s, when I was coming up, there were not enough services. We still struggle, but there were even fewer services at the community mental health level. And so many people with mental illness and substance use problems were being incarcerated. So my expertise in the recovery from mental illness area kind of moved me from the community and outpatient to the prison system, unfortunately. So I had a internship and postdoctoral fellowships with UCLA's Neuropsychiatric Institute that brought me into contact with the prison system in California. And then when I moved to North Carolina to take this job at UNC Wilmington, I was contacted by the North Carolina prison system and asked to come in and do some training and consultation on implementing programs for people in recovery from mental health and substance use. And so it's been interesting. I've also been able to do some research. I became really fascinated with retention of psychologists to work for the system. They have had a lot of struggles attracting and retaining psychologists to work with this population. So I did some research with some colleagues looking at job satisfaction, job stress, organizational structure, organizational stress. And as I'd say in the last probably 10 years, I've started to work more with community corrections then. So alternatives to prison, as we've started to have more opportunities here in this area of North Carolina to serve people in the community as an alternative to incarceration, I've started working more with a treatment court program in Brunswick County.
Well, Sally, that is fascinating, as you say, transition or trajectory through the system and here to UNC Wilmington. So getting back to the topic, sort of the whys of self-care, can you talk a little bit about kind of what is self-care? Because we hear this term a lot and really interested in sort of what exactly is that?
Great question. I think there's a lot more awareness of this even since the pandemic started, that self-care kind of was almost like a niche-y, new agey, go to yoga, take care of yourself. And now we have a much greater, deeper, serious appreciation of what we're really talking about here. It's called self-care for a reason, is that at a certain point, we can't count on the rest of the world to take care of us. We have to find ways to nurture ourselves and guard against things like burnout and the physical, emotional, and cognitive impacts of stress on us. So self-care really is a kind of, I think of it as a collection of ways of being aware of and also taking action in ways so that we can manage our stress and prevent burnout and avoid compassion fatigue in our
Mm.
field.
Mhm.
We're talking about treatment courts here, and treatment courts, yes, there's certainly the criminal justice piece, the jurisprudence piece, but there's also the therapeutic piece. So I think we can look at treatment court personnel and everyone involved in treatment courts as carers
Mhm.
who are caring for others. It's a pretty selfless service, really, when you look at it. So self care in the context of treatment court personnel is extremely important. And even though treatment court personnel make up lots of different kinds of backgrounds and disciplines, they're all coming together for this single mission.
Mhm.
And we hope that everyone involved in treatment courts have great collegial relationships and that they're able to care for us as part of a team. But ultimately, we've got to be the ones to be paying attention to how are we doing so that we can sustain this level of expertise and care and professionalism.
Mhm.
Absolutely.
Can you talk a little bit about this notion of stress and what that involves? And, is it always problematic?
Yeah, great question. And in psychology, we've done quite a lot of research looking at the physiological aspects of stress. Psychologists know a lot about the negative impact on us in terms of our physical health. We we know that the human stress reaction is very adaptive over the course of evolution. We're very lucky that we have a stress response. Our amygdala will fire up as part of our autonomic nervous system fight or flight process when there is danger in our environment. Lucky for us, we're already born to notice that stress and to have physiological changes that we don't have to will ourselves to have. They kind of automatically fire up where we have an increase in heart rate, we have an increase in respiration, our blood pressure increases, muscle tension increases. We even have kind of a cognitive narrowing that can focus on, we almost have tunnel vision that can focus on how can I get out of here.
Mm.
And so that fight or flight, some would say anxiety or fear response, is very adaptive. But when it's sustained, it has a very negative impact because when we fire up in this way, it actually causes an inflammatory kind of wave through our entire system. And so our stress hormones, we release cytokines and cortisol, and this creates inflammation over the longer term. So we end up with C-reactive proteins that are often a sign of heart disease. And what a lot of people don't think about is that inflammatory and firing up response is that also cognitively in terms of what we're paying attention to, the way we think, the way we talk to ourselves, the way we respond, cognitively is also impaired.
Mm.
It's as though our body only has a certain amount of energy that it can expend in one of these areas. And so there's going to be a loss in these other areas. So psychologists have studied the physiological, of course, in terms of behavioral medicine and the long-term effects of stress and illness. But we're also, in clinical psychology, we look a lot at the emotional impact of stress in terms of anxiety, depression, mental health disorders that can result from long-term stress. And we're also much more cognizant now of the kind of cognitive costs of stress in terms
Mhm.
of, are we able to problem solve? Can we make good decisions? Do we know how to navigate difficult interpersonal relationships effectively? Basically, we're going to end up screwing up at work a lot more if we're under stress, and that has to do with kind of the cognitive costs of sustained stress. So we think in psychology of this kind of stress, which is part of life. I mean, we're talking in this program, I know, about stress on the job, but there's stress in our relationships, there's stress in every aspect of our lives, right? But we have stress. And as you said, that's a great point. Eustress is a term that they use in psychology to talk about kind of good stress because stress can be exhilarating, right? Stress can help us get through a very kind of time limited exciting thing like, oh, if I'm planning a wedding, I'm on super high stress alert. I'm so stressed out,
Mm-hmm.
but there's an end point and there are pleasurable, exciting aspects to that planning that go on. And then when it's over and you can relax. So eustress can really get us through some important, exciting aspects of our lives. And most of us even might feel pleasure at that stress.
Mm.
We also know in terms of stress and performance that a certain amount of stress helps us do better. Too much stress decreases our about. If we don't have enough stress, we don't try very hard and we don't perform as well. So there's kind of like that sweet spot of stress that can really make us perform at our best. But if stress continues and our coping strategies are not effective, then we can move into distress. And then distress is going to be that emotional upset. Our body might start telling us that things are not going well. It might affect our sleep. And we might notice we don't have as much energy. And then there can be behavioral fallout there where we start to avoid things that then get us into more trouble. So it goes from stress to distress. And then I'm sort of alluding to the next phase, which is impairment. And that's where we don't perform at our best and others will start to notice. And that's what we're really trying to avoid when we talk about self-care is if we can keep a certain level of self-care at the stress level, then we maybe can avoid going into distress and certainly, if possible, avoid getting into the impairment piece.
Sally, that was really fascinating how you talked about these various levels of stress and how it can be positive, but then how if it continues to build, we can lead to this impairment. Talk a little bit about, if you could, the cost of untreating that stress, untreated stress, I should say. What are the costs associated with that?
Yeah, well, certainly I think we all know what the health costs are. And so in terms of our conversation here today about treatment courts, occupational stress specifically is called, World Health Organization calls this the health epidemic of the 21st century. The stress is part of this health epidemic. And if we look at American business costs, the estimate is about $300 billion a year to American businesses, resulting from absenteeism, people making mistakes, having accidents on the job, various problems created by stress. So it's clearly smart and cost effective to be supporting employees in taking care of themselves. And so I think there's been some expansion in terms of employee assistant programs. I know that most fields in their continuing education, some are even required to do a certain number of continuing education courses on self-care and reaching out for help and things like that. And that's no accident. It's not just because they're being nice. It's because, and nice, and maybe they do care about us. That's nice. But there's also a bottom line to this that we all benefit. We all win when people are taking better care of themselves.
Sally, bringing this sort of back around, as we mentioned previously, to treatment courts and how stress on the job relates to self-care. Can you talk a little bit about what does science tell us about job stress and self-care for treatment court professionals?
That is a great question, and it's such an under-researched area. We have a fair amount of research that looks at job stress in policing, in corrections. There's a little bit on stress that judges experience, treatment providers, psychological services, counselors, psychologists. There's some there, but there's very, very little that looks at a treatment court team population. There was one cool exception, and this was a student did his dissertation, his doctoral dissertation at University of Southern Mississippi. This was Reagan Andrew Downey, who didn't publish his dissertation, but it is the only research that I could find when I looked in that is specific to stress in treatment courts. And What he did was extrapolate from these other areas, these other research areas of what is known about stress in these other populations, and he adapted measures about occupational stress for these different populations and changed the wording to adapt it so that it was relevant for treatment courts. And he found a few really interesting things. So I really appreciate that this contribution, and
Hmm.
I hope he publishes it one day, as it's very useful. And he identified a few interesting things. One was that there really wasn't any discernible difference among the different members of the treatment court teams in how they experience stress. And this was 240 different treatment courts. So he sampled a random sample of treatment courts across the country. He had 233 people responded, and then he had 182 responses that he could use in his analysis. And he looked at differences in stress level and sources of stress for judges, attorneys, probation officers, treatment providers, case managers, and there really was no discernible difference in how they perceive stress or what made them stressed out. So it's pretty homogeneous. And I think if kind of interpreting that finding, that there's a big shared experience among these people. It's not just a bunch of independent contractors coming in and doing their role and doing their thing,
Mhm.
but that they really are working as a unit for a really single focused mission. That being said, there were some stressors that were pretty significant that arose from this data. And one was looking at client factors that related to stress. And they identified working with difficult clients as being particularly challenging. This is part of the nature of the work. When people are in recovery, they're often not feeling very good. They're not at their very best sometimes, and it can be very physically uncomfortable. And so it's not surprising that the clients that treatment courts work with would be hostile at times, defensive, occasionally aggressive. And so working with the more difficult kinds of clients, the staff that were working with that kind of client tended to report higher levels of stress. There are also organizational factors that arose from his work. And he found that role clarity and conflict and job expectations were really important factors in the level of stress people reported. So, looking at role conflict, these were questions like working in drug court involves doing things that are approved by some staff and not others. Or, I often receive conflicting requests from different people working for the drug court. Or, it seems like working in drug court often involves working on unnecessary tasks and projects. Or, I'm often caught in the middle between my supervisor and subordinates. So, these are situations where you're not really sure what your lane is, I guess
Right.
is a way to say that. And that ambiguity of what your role really is and when you're stepping on toes and when you're not can be very stressful.
Mhm.
So I think that that finding really speaks to the importance in treatment courts to train your folks really well, to have job descriptions that really capture what that role is, because when there's ambiguity, it becomes stressful. And that's the general rule for stress anyway, is ambiguity is no fun for most people. Also, this idea that it's kind of an adversarial system in itself, right? Yes, you're unified with therapeutic jurisprudence. You're trying to increase public safety and help people change their lives in ways that they want to change. But it is set up as an adversarial system in terms of a defense attorney, prosecuting attorney. What the client wants might not be what the treatment provider wants, might not be what the case manager wants. So there's can be a lot of conflict inherent in that system. And when those kind of get on fire up, that can be stressful. There was also a variable that Dr. Downey called qualitative role overload. And it's just kind of what it sounds like. These are items like the demands for work quality on me in the drug court are unreasonable. People agreed with that more. They certainly experienced more stress. Working for a drug court is sometimes too complex. The drug court expects more of me than my abilities can provide. And I feel I have sufficient or insufficient training to work successfully in a drug court. So again, these are you trained well to do what you are doing, and are the demands too great?
Mm.
So, not surprisingly, for example, judges who have a large backlog will report higher stress due to this qualitative load. overload. Other aspect about treatment courts that I think a lot of people don't appreciate is that you're kind of always in the spotlight. The
Mm.
public might not ever think about you until something goes wrong and it blows up in the newspaper. And then the only things that people hear about treatment courts are the unsuccessful, controversial kinds of things that happen. And people wonder, is it really worth the money? And what they don't see are all of the successes that treatment
Mhm.
courts have. And those aren't usually championed in audiences that in the public eye. So I think that also speaks to working with communities to help communities understand what the work of the treatment court is so that whenever the press comes along, it's not bad news.
Can you talk a little bit more about other aspects of treatment court work that might lead to stress?
Sure. Well, the clients we work with, the clients that treatment courts work with, I say we as sort of the collective we here, but the treatment courts work with clients who have often had pretty chaotic lives and
Mhm.
continue to have chaotic lives as they progress through the program. And a lot of the goals of the treatment court program is to provide that stability and structure so that they can move from that chaos to more calm. But because this is a population that is so complex, a lot of times the treatment court work deals with crisis.
Mhm.
And it can be very difficult when the crises seem to come one after the other, to recognize that as a professional, this isn't my crisis. This is a crisis that belongs to the client. And to get that objective distance can be
Mhm.
difficult, to still be compassionate and planful. But it feels like emergency after emergency after emergency very often. So even though the stress level for a treatment court professional may not be at the level of an EMT or first responder, sometimes treatment court professionals feel like it is. It is sometimes they are the difference between life and death sometimes for
Mhm.
these clients. So that has also comes with it the risk of what we call in clinical psychology vicarious trauma,
Mhm.
where when you see your clients go through these really difficult, such suffering and unfair, unjust, a lot of times events, it can feel traumatic for us too, for the professional. So that's something to watch for. The other thing is recovery is really slow.
Mhm.
Recovery is
Mhm.
not just a nice diagonal line where you start at kind of a low level of functioning and health. And if you just stick with it, you're going to
Mhm.
succeed. It is a bumpy ride for most everyone. And so being patient for that slow process and not giving up hope. You hear again and again these compelling stories from clients who heal and succeed and thrive. And they say it's because the treatment team never gave up hope on me.
Mm.
And it's hard to keep that level of hope for clients up. And yet that's what's
Mhm.
demanded of treatment court professionals. So I think that patience and is really important because the client's in it and they get bored and they get
Mhm.
impatient. And for the professionals to be able to sit back and say, well, that's normal. That's hard for us because we'd like them to hurry up
Mhm.
and thrive in the potential and strengths that we all see in them that they may not see. So patience is a big part of it. Compassion fatigue, I mentioned before, I think that's very aptly named, that you can only sustain this kind of give fest that this work tends to be
Mhm.
so long without nurturing yourself and filling yourself back up with compassion and support and nurturance, because signs of compassion fatigue are actually signs that we potentially could harm our clients. When we don't take care of ourselves and notice that we have compassion fatigue, we can lash out in anger, we can become very defensive, we can get into conflict with each other. And so that can have a big cost. Depending on where your treatment court is located as well, or how large it is, it can be a kind of isolating experience. I know you all have talked to treatment courts around the country, and some of these treatment courts are located in very isolated areas.
Mhm.
And when you don't have colleagues that do exactly what you do, you can feel lonely
Mhm.
and doubt yourself a lot more than when you have a community of people and professionals that are sharing your role. Back to the issue of clients, too. I know I mentioned before that recovery is uncomfortable most of the time when you're going through when you're going through recovery yourself and responding to treatment. Sometimes you don't feel very good and might lash out at providers and the rest of the treatment court personnel. So, as a professional, you might get sick of not being thanked.
Mm-hmm.
Yeah.
You
Yeah.
might start to feel like, why aren't these clients more grateful for all of the sacrifices and all of this that we're doing? We're so on their team. Why can't they see it? And to see that that's actually part of the work is difficult. So, we can't expect our clients to make us feel good, to make that be the primary reinforcer for doing this work. Indeed, we want to enjoy and celebrate accomplishments and the appreciation that clients will give us. But if our sense of self worth and importance is dependent on positive feedback from your clients, that's a recipe for burnout, for distress and impairment. Sometimes on the treatment team, too, if you've got a small group and you don't have role overlap, if you're out for any period of time,
Mm-hmm.
if you have, in this era, I know that people have been scrambling for coverage with family illness,
Mhm.
that you can feel like, well, I can't stay home and take care of myself. I can't take time off. I can't. There's no one else who will step in to do what I do. And to some extent, often that is true. So to try to find in your teams ways that you can provide backup is really essential. And to talk to each other as your teammates
Mhm.
uh, about, hey, if ever you need something, I'm here for you, or to have an official way to cover so that staff don't feel like they have to ask a favor from each other in order to take care of themselves. Again, that's
Mhm.
a recipe for distress and impairment. There's also this sense that your work is never done.
Right.
Mhm.
Right? It's
Absolutely.
how nice it would be to come in and just generate a to-do list for today, and then when you get to the end of your to-do list,
Mm-hmm.
then you can go do ABC. Well, that to-do list just doesn't ever end because as soon as you cross off a couple of things, 5 more come in, and it's already 4 o'clock in the afternoon.
Mhm.
So, I think there's also I think in Western society, we're sort of conditioned to see things as checklists and things that can be finished, and then we can reward ourselves when they're finished. And this just is not the kind of work that's going to be conducive to that expectation or model.
Right. So recovery doesn't happen on a 9 to 5 schedule, right?
Exactly. Exactly. And then something else that I saw actually in the literature that I hadn't thought about is stress that judges sometimes express in that they're concerned about the financial
Mm.
sustainability of their programs. And it's not just the judges, but everyone in the program. So grants are fantastic for an infusion so that you can be creative and expand your program. But if you're not able to find a way to sustain that programming after grant funding has ended, then your community, your clients, your colleagues, it's a tremendous burden to feel that you're responsible for that. So, uh, we were talking before about how to get the good news out, the good messages out,
Mhm.
marketing your treatment
Mm-hmm.
court program. That becomes really important in terms of reducing that stress of we got 2 years and then we don't know where our funding is going to be. Or some courts, I'm sure, go year to year. Will the county commissioners
Mm-hmm.
continue to support us at the same level? Uh, it's stressful.
I agree, Sally. And this work can be thankless, and I can see how those issues would definitely arise for individuals working in the treatment court. Thinking about the signs of stress, or as you mentioned before, going from stress to de-stress to impairment, has there been research that indicates sort of the signs to be looking for or that may indicate somebody is going in that direction? And I guess maybe specifically around how would this apply to treatment court staff? I'm guessing it's a kind of a general application, but if there's something specific related to treatment court staff.
Yeah, absolutely. We don't have anything specifically related to treatment court staff, but extrapolating from what we know about job stress and impairment and applying it. And I think that we can kind of fill in the blanks of what this might look like at a
Mhm.
treatment court personnel. One is when the personnel, when the staff member starts to become more isolated or withdraw. They used to have lunch with a couple of people in the middle of the day, or they took a little bit of time to take a walk around the building and they stopped doing that, or they go to their car more often. Sometimes they go to their car to smoke or go to their, so isolation, withdrawal. Also, sometimes if they stop responding to emails as quickly, that can be a sign as well. So, isolation and withdrawal. Physical exhaustion. You just
Mhm.
feel like I can't go up. I got to take the elevator. I can't make it up these steps. You look in the mirror and you look more tired than you used to. Sighing, interestingly, is kind of a sign of exhaustion too. That when an employee notices, I'm sighing, I almost feel like I can't get my breath. I feel heavy. These are signs that you're having physical manifestations of your stress as well. We talked before about compassion fatigue, where people, when they used to be quite empathic, tend to then start to snap a little bit more, become jaded,
Mm.
use gallows humor more. That's a sign. Loss of meaning of the work. It's why did I get myself into this?
Mm.
I could have been doing something else. I had these other opportunities. What is this all about? Is this really helping? Everyone has those thoughts. That's not abnormal. That's not bad. But if the employee notices that they're thinking more about that and have serious regrets, that's probably a sign that we're moving from stress to distress to impairment. Defensiveness on the job.
Mm.
Defensiveness, as a clinical psychologist teaching clinicians to tap into their own defensiveness with their clients, this is just as important and relevant for treatment court personnel, that when we become defensive, it's easy to see what's happening it's not easy to see, but for a psychologist looking at it, it's easy to see that why we even call it defensiveness, because we think back to that fight or flight response that we get in response to a stressor, and we're ready to do damage, right? We're ready to do battle. We're ready to defend ourselves. And that's really a response to stress, this defensive kind of interaction style of making excuses or lashing out at others or not being willing to reflect on one's own responsibility in a particular situation. That defensiveness is usually a sign that we're not effectively nurturing ourselves, that we can be more open to feedback from others. Another is resistance to change. I know myself that each time there's some kind of new technology or electronic medical record or way of tracking clients, I'm like, oh my gosh, I have to learn something new. I don't have any more brain power for this. I try to spend about a half an hour doing that and complaining and being mad about it. And then I try to shake it off and just do it, because the more time I spend grasping at what I don't like, it just tends to drain my energy away from all of the things that I should really be doing. But that's when I'm not feeling a high level of stress. So I think that that's something to watch for too, that in treatment courts, when staff are expected to adopt some new practice or new policy and procedure, it is stressful. It does ask a lot. So the more that we can kind of smooth the way for those innovations, I've got air quotes here, innovations that are going to be gone in another 2 years when they find the next innovation, to really understand that that does create stress. That's important. And then increase in complaints. So if a member of a treatment court team is written up, that's probably a sign that there is stress. Let's look for stress there. Rather than attribute it to something internal to that team member, what are the stressors that they're facing right now, and to see if they can examine those carefully. That will really be an important way, I think, to smooth the way to improvement as well.
Dr. MacKain, we would like to provide listeners with a call to action on each podcast episode. Can you talk a little bit about the ways that folks can incorporate the research and the science behind self-care into their daily practices?
There's a terrific resource. It's actually in the psychology field, but it's a book called Leaving It at the Office, A Guide to Psychotherapist Self-Care. And even though it is directed at psychotherapist. It has wide relevance to everyone, wide applicability to everyone. This is by John Norcross and James Guy. And so I went through their self-care checklist, which, by the way, has got like 500 things on it. And it's so helpful because I think when most people hear self-care, they think, oh God, I have to go join a gym now and it's so expensive and it's cold outside. I don't really want to go for a walk and
Mhm.
I don't really like healthy food. Uh, so usually we get this idea that, oh, it's almost like a New Year's resolution time and now we have to take care of ourselves and we have to further inconvenience ourselves, especially if it's this ethical imperative that we talked about before. Not only am I working so hard for my clients, but now I also have to put on the list that I got to do self-care
Mhm.
and that it's these big things, but it's not the big things. And particularly when we look at self-care in treatment court personnel, there are so many things that people can do in their daily work that doesn't take extra time, maybe 30 seconds. So I just wanted to go through a few of those. I adapted some of Norcross and Guy's items on their list here. One is to remind yourself why you went into the field in the first place. What is the meaning and purpose of what you're doing here? Because working in a treatment court setting is so generous. It's so bold. It's such a leap of faith and shows such a passion for goodness. Because indeed, they could be doing a lot of different things. They chose this. So if they can remind themselves again, what was it that attracted them to this? And what does that say about them and their value system? That can be very nurturing. Something else, if you're lucky enough to actually have a workspace as a treatment court personnel, a lot of times people are just in their car. But even in their car, if they can have music, if they can have something personal, familiar, beautiful, and certainly there are ethical concerns because clients shouldn't see a lot of personal information or things like that. If they're in your office. So you want to be careful with everything that you display, but you want to be sure that you have a fine line between, or a good line here between your privacy and your personal life, but also something that sustains you in your daily life. So a beautiful photograph, a poem that someone once wrote for you, something personal. There is a great area of research that has got a good evidence base called self-compassion. And Elizabeth Neff has written a wonderful book here. And she's got a great website with free exercises and resources. And she talks about how just taking a quick self-compassion break can be sustaining. And what she says is if you can just stop for a moment and say to yourself, this is a moment of suffering. This hurts. Suffering is part of life. And what can I say to myself now that shows kindness? Can I say, I forgive myself? May I show myself the compassion that I need? So these are, again, things that are free. They're very personal. No one has to hear you saying them. You can say it to yourself when you feel fired up at work. Another is to just relish compliments that you get. I think that we've moved away from positive reinforcement of grades or of people telling us our parents telling us what a great job we did. And as we get into our careers, we find like, oh, we get fewer and fewer compliments. And so we have to start complimenting ourselves. Oh, does that seem fake? But indeed, talking to yourself can be very adaptive and just telling yourself, hey, that was awesome, or good job. Just talking to yourself can be helpful. But then really zeroing in on the compliments and positive feedback you do get from your colleagues, that you do get from your clients, just absorb those. I think that people often struggle with accepting compliments, and this is
Absolutely.
something that we really need to work on if we're going to take good care of ourselves. Another is to share your stresses with a trusted colleague. At least one. If you have one trusted colleague that you can share your stress with on a day when things are hard, that will help to sustain you as well. Another is to keep work at work, and that sounds so easy, right? The name of that book that I just told you is Leaving It at the Office, right? How do we do that? But what we know from research is that what really sustains us is quality time with friends and family. And I don't know how we have quality time with friends and family when we're thinking about work
Hmm.
or when we're stressing about work or when we're talking about work. So find a way to make a delineation between your workday and walking into that door at the end of the day. I read a really moving account of a nurse that worked on a burn unit, and you can just imagine the suffering and pain of the patients on that unit all day, every day. And so she would go to her car, and before she got into her car, she would take off her white coat and put on some kind of familiar, nice, comfy sweater before she would get into her car. And then she would drive, and before she would go into the house in her driveway, she would get out of the car and she would do jumping jacks and run in place and say something kind to herself, and then she would go in. So she had a noticeable change just in terms of what she was wearing and also kind of the freshness of breath that she had when she was able to go in and greet her family again. So that's just one example of ways that you can have that delineation. I think in the old days, it was, oh, you stop at the corner bar and get with your friends and,
Hmm.
kick back a couple of drinks. That's not a long-term solution to what we're talking about here. But these little free things, right?
Right.
Nothing costs money. Nothing I've mentioned so far costs anything. Another related is to move your body. Okay, I didn't say join a gym.
Hmm.
I didn't say run a marathon. I said move your body. And can you do that during your workday? Can you find a way? And this isn't get more steps in, get that, Fitbit or whatever it is. That's not it. Just move and feel the pleasure. If you have a body that doesn't hurt when you move it, wow, isn't that a great thing to acknowledge to yourself? It's like, wow, I'm not feeling pain right now. Wow, I can really to relish what it is like to have a body that can move and to move it several times a day. And then the last thing I wanted to mention too relates to the research that we talked about by Dr. Downey in his dissertation, and that is to try to get clarity on your role if you do feel stress that's related to ambiguity of your role, if you feel like you're kind of stepping into the same landmines over and over again and that it's stressful, think about the clarity of your role. Think about getting supervision, consulting with your colleagues about getting more specificity about what your role is on the team.
Well, we want to thank Dr. Sally MacKain for coming on to this episode and just giving us such great information about the whys of self-care. So thank you so much, Dr. MacKain, for joining us today.
It was my pleasure. Thanks for having me.
And we want to continue this discussion around the whys of self-care and other topics related to treatment courts. Hop over to the discussion board. We have a discussion board specifically for podcasts. We would love to hear how you are implementing some of these self-care practices into your everyday life, be it as a treatment court professional or any other occupation that maybe you are a part of. We hope you'll join us again for the next episode of Justice to Healing. And as always, remember, we can all do better.
To our listeners, we thank you for listening and we hope you enjoyed the show. Be sure to hit subscribe to stay updated on the podcast. Follow us on Facebook, Twitter, and LinkedIn to stay engaged with us, and check out our website at ndcrc.org. Thanks again. Catch you next time on Justice to Healing. The Justice to Healing podcast is presented by the National Drug Court Resource Center and was supported by the grant number 2019 DC BXK002, awarded by the Bureau of Justice Assistance, which also includes the Bureau of Justice Statistics, the National Institute of Justice, the Office of Juvenile Justice and Delinquency Prevention, the Office for Victims of Crime, and the SMART Office. Points of view or opinions in this podcast are those of the author and do not necessarily represent the official position or policies of the United States Department of Justice.